Sorry about that, folks. My microphone died right there at the end. It's been dying, so it finally just bit the dust. Osteochondrosis is avascular disease of the bone. The most common one we think about is Lenz-Gastaut disease. This one is self-limited. The ends of the bone usually become necrotic. The younger the child is with this, usually the better they do. You can usually just treat this with NSAIDs. This is a picture here, not a great one. Let me see if I can find a better one. Okay, if you see this is nice and round and smooth, and that's kind of like somebody ate the end of it off. That's what it looks like on X-ray. It's pretty impressive. Surgery may be necessary, but usually not. Of course, the older the kid, the more we're going to be concerned about this, but this is one I would refer. We had, one summer we had 2 kids with this at the same time. One went to Shriners. I guess they tend to be a little conservative in the treatment, and just did NSAIDs, the one, and kid the same age, same disability, same look at X-ray. Went to MUSC, and they were really pushing for surgery. So just, I guess everybody has a little different approach. Cerebral palsy. Now, one thing your book has in there apparently is that cerebral palsy can be diagnosed as an infant. No, it can't. Maybe the causation, if you know there's a brain malformation, you can pin cerebral palsy on that. We always think about low APGAR scores, but that's really not linked very well. So you really have to wait and see if the kid develops cerebral palsy to muscular dystrophies. We went over this with genetics before. There's lots of different kinds of muscular dystrophy. Duchenne's muscular dystrophy, the most common one, is X-linked. You will see these kids doing a lot of toe walking as an early sign, but there's usually a family history too, so make sure you get that. Make sure you read all this. They'll have these big developed calves from walking on their toe. So just a little bit more on muscular dystrophy here. These are a couple of other different types of muscular dystrophy. Just kind of look at them real closely, or look over them. Duchenne's the big one you need to know. Becker's is another one that probably you need to know. Then they go into bone tumors. Just kind of read over this. They can definitely occur. So you've got someone, especially that has a pathologic fracture, good reason, you know, in the back of your mind. So just read over this information right here. And just like any other kind of cancers, there's different types that affect here. So just, you know, Ewing sarcoma is the one you kind of hear about the most. The sites for Ewing sarcoma. And then malignant muscle tumors, rhabdomyosarcomas. We actually had a child with this a few years ago, and it was pretty significant. The kid went to stay with her dad for a week and came back with this lump on her arm. But the lump had a big vascular supply, so it was like, ooh, this is not normal. And turns out that's what it was. They just removed it. So far as I know, she's doing pretty well. And then non-accidental traumas. And this is a question that comes up sometimes. You are legally obligated to report if you think there's any chance that there could be child abuse. Okay? It's not your job to decide who's telling the truth. Okay? It's your job is to report it. Okay? So if you've got someone with fractures that are healing at different rates, it could be osteogenesis imperfecta, pretty rare. Child disease is much more common, and I think even a parent, once they're really thinking about it, will realize that it's better to report a suspected child abuse than let a child be killed. We had a situation in our office a few years ago. An infant came in with a bruise, like a 1-month-old infant came. But the mother explained that the toddler tried to pick it up. This seemed pretty rational to the person that was on the child, and so just kind of wrote it off as, the sibling being a little aggressive with the child. Well, then the baby was admitted not even a month later with a skull fracture, and I'm not even sure that child made it because of being beaten up by the stepdad. I couldn't tell you the statistics. I don't know them. I could probably look them up, but I'm not going to. But the number one person, in my experience, to abuse a child is the boyfriend. Not the baby's dad. They'll be up there too, but the boyfriend. And most of the time, the mother will defend the boyfriend over the kid. If there's a non-biologically related adult male in the house, and you have a kid with anything, be super suspicion. Now, that's not always, but it's definitely something that I've seen over and over again. Anyhow, hope this helps.